convoluted things, those represent nasal concha. They're the little bony things that are covered with stratified squamous epithelium. They moisten and warm and circulate the air as it moves into the nasal passageway. Okay, right here begins the nasopharynx. Now the pharynx, the whole thing, begins here, extends all the way down to here. And there's 3 anatomical regions to the pharynx. Right here where it begins behind the nasal cavity, this is the nasopharynx. Here, and it's shown here with this little circular region, right opposite the oral cavity, this would be the oropharynx. And then from here down to the larynx, this whole structure is half of the larynx. So from there down to here would be the laryngopharynx. All of those 3 anatomical regions of the larynx. Okay, now, the pharynx, excuse me. Now, let's back up here. This circular opening here represents the auditory tube. You know, the one that connects the middle ear, okay, to the pharynx. Or you can call it eustachian tube. But don't call it auditory canal, because that's wrong. Auditory canal is from out here to the tympanum. Okay. Okay, so backing up, this bony area would be the hard palate with this stippling. Then, where that runs out, we call all of this soft palate, and this terminal portion, which hangs down, distends like a membranous curtain at the back of your pharynx. That's the uvula. Okay. This would represent sphenoidal sinus. This would represent frontal sinus. And I don't think these are on your list. And if they're not on your list,
frontal sinus
is it? Mm-hmm. Okay. Well, that would be it up here, because this is the frontal bone. Of course, this represents the sphenoid. It extends across. Okay. Of course, this would be the mouth, and this all would be the oral cavity. Contains a tongue. This across here, actually, I don't think this is on your list, but this bone is the maxilla. And these are the palatine processes of the maxilla. This bone down here, remember, these are cut across, so this would be the mandible. And I don't know whether these are on this list or not. Probably not, because those were things that you would have studied in A&P 1. Okay, now, down here, from here down to here, is the larynx. Hand me that one right there, yeah.
You want pieces or together?
No, this is fine. This is the same thing. We're just looking at like this half of it, okay? Okay, that's just a half of it. You put these two together, and that whole thing is the larynx, and it extends from this cartilaginous plate, which is called the cricoid cartilage. On this, it would be represented by this across to there. Blues represent cartilage, okay? So this allows this whole larynx to sit on top of the trachea, okay? So that cartilaginous plate is called a cricoid cartilage, okay? This one would be looking at it like this, cut across there. That would be the end of this, and this whole thing is the thyroid cartilage, okay? This is a thyroid gland. Now these are on your list there, but I'm trying to, this is kind of hard to perceive this looking like this. It's kind of difficult to understand. Okay, so back to this. This cartilaginous plate is comparable to this one. I better use the other bits, the matching piece. That would be the epiglottis. Okay? And if you put these two together, you can see the epiglottis is that. And what happens when you swallow, this bends down, the trachea moves up and closes off that opening. That prevents food and food and beverages from going here and makes them continue on down this tube, which is the esophagus. So this opening down here, going through there, which would be this opening in here, is the glottis. Epiglottis covers it, yeah, or closes it. Let's see. Oh, of course, this across here represents the vocal cords. It's the same thing as this inside here. These represent vocal cords. They, as air passes through, they vibrate. There's muscles underneath them that can change the tension. The quicker they vibrate, the higher the pitch. The slower they vibrate, the lower the pitch. Let's see, am I missing anything out on this one? Just remember that this is the esophagus here. I think I probably covered everything. Oh, of course, this is the hyoid bone. And I think.
Do you need to look at that?
Well, you're going to be studying this over there. I mainly wanted to get these things because I knew you didn't have an index to go with these. I think that's everything.